Hello, everyone. I'm Annmarie Seldon with the National Library of Patient Rights and Advocacy, and my guest today is Kyla Greenstein. She is a fourth-year pre-med student at Northeastern University and a contributing author for the new book, Unpacking Global Health. Welcome. So,
Thank you so much for having me. I'm excited to be here.
thank you. So let's get into it. Let's talk a little bit about your background and your patient advocacy work.
Yeah, so currently I'm a student at Northeastern, like you were saying. I'm majoring in health science with a minor in global health. My interest in global health is what really made me interested in contributing to this book. A lot of my coursework is very public health focused, so I kind of get to see healthcare as a whole instead of more just the sciencey things that you might think of when you hear health science. I had been able to participate in Northeastern's co-op program twice, where I was able to have lots of patient care experience in some of the hot Boston as a patient care tech on a hospital floor and as a medical assistant in an outpatient setting in an orthopedic clinic. And this really exposed me to a diverse set of patients and really expanded my perspective on different health issues, specifically in Boston, which with such a diverse population in Boston, I was able to see several different things happening. I also volunteer frequently at the Red Cross Boston Food Pantry, where we specifically serve healthy foods, which can help combat diseases that can develop from improper nutrition or other food related causes. I've always had an interest in healthcare and medicine, and specifically global health. When I was in high school, I was fortunate enough to be able to participate in a health initiative program in the Dominican Republic. We learned about public health issues and participated in WASH efforts. WASH is water, sanitation, and hygiene. And we also helped run pop-up clinics with local providers to provide healthcare access to people who may not normally have that access. And this experience was really the eye-opening moment for global health for me. It made me realize that a lot of global health isn't like a big mystery. It's just so many people don't have access to the proper healthcare and treatment. So
And
when
that's
I came to
important from a patient perspective.
yeah, absolutely. I think where we are in Boston, there are so many hospitals, so many points of access that it's hard to even imagine that people may not have a car and they may not even be like 5 hours close to a hospital. Might be so far away that they can't even receive that access. Um, and so when I came into Northeastern, I made it a goal to participate in another global health opportunity. So I was able to do some courses in Ghana for a month-long experience where we took lectures from local professors, and we were able to shadow hospitals there and clinics, which once again opened my eyes and broadened my perspective to other situations in global health.
That's great. Well, let's talk about the book. There's this new book that you've been a part of, Unpacking Global Health. So you are a writer on the book, correct?
Yes, yes. I wrote two of the chapters, communicable diseases and non-communicable diseases.
That's great. And so tell us the importance of bringing awareness to global health. Why is it crucial to examine global health?
Right. So, like I was mentioning before, it's the crucial part is the education and the access, which I think is was such an amazing part of writing the book is because I know it will contribute to the global health education. Global health kind of views health of the world from like a really big lens. And then you can take a step back and view all of the contributing factors of health issues. And then you can dive into certain populations to see what makes that population or geographical area different that may be leading to disease or even a good quality of life, like blue zones, for example. Those are great qualities of life, healthy, long lives. Unfortunately, several other areas of the world, it's more on the bad end where they have more exposure to disease, less education to prevent the diseases, and less access to screenings, treatments, and just healthcare in general. Um, I think the epidemiology of the base is the base of global health, which is figuring out the trends and the numbers of these issues around the world. But then it kind of splits into medicine and public health of those communities. And the medicine is the science and the research providing treatments, screenings, diagnoses. And the public health is more at the larger scale. How can the policies be changed? How can there be more clean water provided and healthier foods provided, and ensuring access to health care as well can be done through policy.
Wow, you talked about a lot of different issues and challenges. So, what would you say the biggest challenge affecting global health? You mentioned education, but if there's one that you could speak to that really brings attention, even for like legislators, for example.
Yeah, absolutely. I think resources can really build that education and access. So providing resources has actually shown immense improvement. For example, HIV used to be extraordinarily high in every region of the world. And on a recent WHO report, it has shown exponential decrease, actually, because of the screenings and the resources to treatment. A lot of these treatments aren't complex things. It's really just the access. So, donating, providing resources, whether that is treatments or even providers or technology for the screenings, that's all super important things. What's like a big challenge is that while we have spent so much time and effort in limiting communicable diseases such as malaria, HIV, like I said, which we've seen an immense decrease due to vaccines and treatments. Chronic diseases are on the rise, specifically cardiovascular disease. Chronic diseases cause around 75% of deaths globally, which is an immense amount. And chronic diseases can most likely be prevented through education, like I was saying, and understanding how the body works and to keep yourself healthy.
Well, you touched a little bit upon vaccines, and can you talk a little bit about the vaccine in the global health space? I mean, that's important as well, correct?
Yes, yes, absolutely. And I use the word resources as a very broad term. Vaccines may be seen to someone as just a preventive treatment, but I think vaccines as well as providers are resources. So there are limited resources everywhere. And I think it's important that the the nations that have the money and the time and the research and the personnel to develop these resources and help spread them to allow access to other nations that have limited resources, limited access. I think it's really important for the nations that have the ability to help the communities and nations that don't have the ability to.
Very good point. As patients of the healthcare system, what can we do to help? Is there anything from a patient perspective?
Yeah, of course. I think, and this is a running theme, is staying educated. And while you're staying educated, you can educate your peers. Just understanding that not all areas of the world have access to healthcare or even basic necessities like clean water, which can lead to developments of disease, or nutritious food, which can lead to developments of disease. So by educating yourself and educating others, more people will feel empowered to want to make a difference. You can also donate to organizations that provide healthcare to communities with limited access, or programs that increase healthy foods, clean water, and health education.
This is really interesting. You mentioned some stats earlier about global and other nations, but here in the US, obviously getting access, even Americans getting access to good quality healthcare is hard too, correct?
Yes, absolutely. Especially in rural areas, there's geographical disparities when you're living far away from any healthcare, but there's also financial disparities. People that can't afford insurance, or they don't have insurance, or they don't understand how the healthcare system works, so they don't think they need to go. So there's several different ways that within the United States as well that there's limited healthcare access.
Mm.
I also wrote in another book about expanding healthcare access to rural communities because that is something that the US struggles with. And there are many medical education institutions that are encouraging rural medicine. And it's very interesting to see, and I'm excited for the strides that they'll take to rural medicine access.
Right, right. World medicine is so important, obviously, and we've just kind of gone through a recent election. So I don't know if you have any thoughts on that. Obviously, there's been a lot of talk about, where our healthcare is going in 2025 and beyond.
Yeah, it's definitely a interesting time to be observing it from a policy standpoint. Um, what is what I'm thinking about is the states seem to be really stepping in and trying to take control, which is um, good for some states with providing health access and not so good for some other states. I do believe that with more advocacy and policy, that we can help people who are in search of specific healthcare get the healthcare they need.
That's great. That's great. Well, this has been very eye-opening. Thank you so much for taking the time to speak with me today. Do you have
Of
any
course,
last
thank
minute
you.
thoughts before we end the interview?
Um, I don't believe so.
Well, this has been great. And obviously, we want to raise awareness of this issue and have people go out and purchase Unpacking Global Health, which is edited by Caitlin Laska. So I want to thank you so much for taking the time and until next time.
Yeah, of course. Thank you so much for taking your time as well.